COVID-19 is a new coronavirus which is spread by respiratory droplets of an infected person to others with whom they have had close contact. Approximately 1 out of every 5 people who get COVID-19 will have difficulty breathing and become seriously ill. Not only has COVID-19 caused infection, but it can cause an increase in feelings of anxiety, stress, sadness, confusion, and fear, as this is a new and unexpected event for everyone. By learning more about it, doing our part, we can help stop this pandemic. While some people may have no symptoms while infected with COVID-19, common signs and symptoms can resemble a common cold or flu. The most common symptoms include dry cough, fever, and fatigue. It can also include sore throat, muscle aches, nasal congestion, new shortness of breath, new rashes, discoloration of fingers or toes, diarrhea, loss of taste or smell. If you or someone close to you has any of these symptoms, please ask to get tested for COVID-19 and try to self-isolate and/or practice social distancing. Myth: COVID-19 isn't real, it's a made-up disease. Fact: COVID-19 is a very real infectious virus that has infected thousands of people, including people living in shelters. Myth: you can only spread COVID if you have a cough or sneeze. Fact: COVID-19 can spread by coughing, sneezing, touching contaminated surfaces, sharing personal items such as drinks, utensils, food, cigarettes, pipes, and so on. Myth: COVID-19 only affects those that are older. Fact: COVID-19 can affect anyone. Those that are higher risk of complications include those with asthma, COPD, diabetes, cancer, and heart conditions. Those with mental health and substance use disorders may also experience an exacerbation related to the impacts of this pandemic. If you feel this may be impacting you, please speak with shelter staff, a trusted friend, and call or visit your healthcare provider. Myth: if I go to a COVID isolation site, I can't do the things I like to do, and I'm locked in a room for at least 2 weeks. Fact: COVID isolation sites are simply extra spaces used to provide isolation for people who may be or are confirmed to have COVID-19. This isolation site may be in a hotel, a different section of the shelter, or other building. This space is not a punishment and offers harm reduction ways to continue your usual daily activities in a more private setting.
COVID-19 asks people to stay alone in their own home to avoid getting the virus. This can be challenging to do if you live on the streets or in a shelter. That being said, we are here to help you. Please take the next few minutes of your time to watch this video to empower you to protect yourself and others from COVID-19. Since no treatment was found until now, prevention is the best plan to date. Practically, here are a few steps that can help you stay healthy despite your homelessness. By keeping your mouth and nose covered, you can keep them protected from other people's germs. There are face masks available here at the shelter, which you can keep and wear if a distance of 2 arms length or 6 feet with others cannot be maintained. If you do not have a mask available to you, you may use a scarf or shirt to cover your nose and mouth for added protection. The mask face protection should be put on after you have cleaned your hands, and you should be careful not to touch the outside surface of it. Place the mask on your face, mold a rigid edge of the nose, and finally position the bottom edge of the mask under your chin. Remember to cough and sneeze in your elbow instead of your hands to prevent germ spreading as well. One of the most important measures you can take to protect yourself and others is to properly clean your hands as often as you can, since the hands are the biggest source of contamination to your face. Here are the proper steps to hand washing. First, wet your hand with water, then add the soap. Scrub well for at least 20 to 30 seconds, the time to sing your favorite song. Make sure you scrub the nails in between the fingers, the sides of the hands, palms, back of the hands, thumbs, and wrists. Then rinse your hands and dry them properly with a clean paper towel. Do not forget to close the tap with the same paper towel to avoid recontaminating your hands. The same scrubbing process could be repeated with hand sanitizer we provide you, should you not have access to soap and water. We acknowledge keeping a distance of 6 feet with everyone may be a big challenge to you. However, it is something that could really make a difference in keeping you safe, since often when people talk, they can spit, and that spit won't reach you if you're 6 feet far. Same goes with coughing and sneezing. Other ways to keep social distancing include sleeping head to toe, staying apart when in groups outside, avoiding crowded areas, not shaking hands, hugging, walking rather than using public transit. As you can visibly see, the capacity of the shelters was decreased to allow for the social distancing to be in place, and regular cleaning is in place. Please respect these rules and stay to your designated area to ensure your safety.
During COVID-19, our shelters will be adopting practices recommended by public health that will put your safety first. Our shelters will now have warm and friendly screeners at the entrance. They will ask you questions about your health and any exposure risk. If the outcome of your screening is to refer you for testing, we will arrange transportation to a testing center. We have reorganized the layout of our shelter into zones. Zone A, those clients with no symptoms and no exposure. Zone B, those on self-isolation following potential COVID-19 exposure. Zone C, those who have symptoms and are waiting test results. Zone D is a secured location that is away from the shelter for those who have been diagnosed with COVID-19. Our shelter has trained staff to assist you through this ordeal. Other changes that is aimed at protecting your health is to limit visitors. We will make provision of other services, example group sessions, be available virtually, example online or by telephone. If you are transferred to a hospital, we will provide storage for your belongings and we will ensure a space for you here upon your discharge. Volunteers and sponsors have provided daily healthy meals to keep you healthy. We have partnered with public health, primary care providers, and other allied health workers to ensure access to local community mental health programs, primary care providers, social workers, local addiction and harm reduction, such as supervised consumption facilities, managed alcohol programs, methadone clinics, and access to naloxone kits.
We all have a duty to protect each other and do our utmost to ensure the virus does not spread. Here in the shelter, we acknowledge that your situation is not an easy one,
and we are committed to help you in all your needs.
As we strive to keep you safe and healthy, we all have the duty to protect each other and do our utmost to ensure the virus does not spread.